Hello, good morning. Thank you for joining us. And thank you everyone for being here. We've got a packed room and really appreciate the energy. I know it's been a big week for everyone here. And also thank you for everyone joining online. I know not everyone had the opportunity to join us in Geneva, and it's really important that the lessons learned and the stories shared reach everyone around the world. So I appreciate everyone tuning in today. And we've heard a lot so far about complex global health challenges. And one of the things that I'm excited about this program today is we're addressing not only the complexity of a lot of these health challenges, but also those issues that are overlooked and don't get as discussed or as much research funding, but are right in front of us. And so I'm really excited about the conversation today about vision and addressing poor eyesight around the world, but particularly as it relates to refugees and displaced populations. You may not be aware, but over 2.2 billion people around the world have poor vision. And about half of that could be corrected with relatively low-cost interventions. And we're talking about innovations, and we often think of advanced technologies and what could be done in that regard, and often overlook some of the lowest cost interventions that can have real, immediate, and cascading impacts. And so, Anurag, I'd like to turn to you first. When you're thinking about this challenge in the work that you're doing and the foundation, how do you see this issue in terms of being able to intervene for what is one of the largest disabilities around the world? And what are your priorities in terms of tackling that problem and how that can really address not only eyesight, but the Sustainable Development Goals?
Thanks, Alison. We believe that uncorrected poor vision or having blurred eyesight, to be simplistic, is the largest disability and the most hidden disability in the world. And there are a couple of reasons for that. So to put it simply, 1 in 3 people cannot see the world clearly. Now, that might not be true in this room, but it's true in every developing, underdeveloped context in the world. And if you think about it, it's not really a health problem. It's a quality of life problem. And also, I see it as probably the biggest opportunity to unlock productivity in front of the world. The primary reasons for that are there is no access. People do not have a place to go to get a simple eye check and a pair of glasses. There is no awareness. People don't know that they have a problem, or there are social taboos. And the third problem is that the policymakers, the influencers, the decision makers sort of take this for granted. If I look around this room, probably 1/3 of the room is wearing a pair of eyeglasses, and for us it's very intuitive. If I have a problem with the eyes, I know where to go. I know how to get a pair of glasses. But if for people in the room who are wearing glasses, if you take off your glasses for 5 minutes, you will realize what 1/3 of the world lives on a day-to-day basis. But I'm not trying to paint a very depressing picture, because we look at this as a big opportunity to unlock holistic quality of life. There have been multiple studies on hundreds of billions of dollars every year on lost productivity because people can't see clearly. But it goes beyond. It has a link with seemingly unrelated facets of life. Educational outcomes, gender equality, female labor force participation, even climate change. So there is a strong link, published research on how a simple intervention of helping people see clearly can make a huge difference. It has a linkage to most of the SDGs. And there is evidence to suggest how this intervention could be the medium, and probably the easiest medium through which you can make an impact across these areas. With UNHCR, with refugees and humanitarian relief projects, we decided to try this approach with UNHCR because we really believe that having this intervention could make a substantial impact in the lives of those who have been displaced, who have been forced to leave their homes. And the same model applies with many other aspects which cut across SDGs.
Thank you for that, and I love to bring you in, Sandrine, to paint the picture and to provide some context in the work that you're doing. Over 100 million people around the world are refugees, are in displaced situations, areas of conflict, and we're seeing that around the world. And also, 3 out of 4 of those with poor eyesight are in low and middle income countries that don't have as direct access to healthcare. And so in the work that you're doing, and we'll dig into this partnership a little bit more in just a few minutes, but in your experience and the work that you're doing, how are you seeing poor eyesight affect the populations that you're working with?
Thank you, Alison. I think, is it working? Yes. No? Yes, now it works. So I think, as you said, 2023, 114 million refugees in the world, so the highest number ever. And, when we're looking at perspective, the number is going to increase. And, of course, when you're looking at the needs, and when you're looking at the resources that we have, definitely there is a huge gap. And so in organization, we have to prioritize and we have to deprioritize. So when we're looking within the health interventions, obviously we have to focus on the life-saving interventions and, also on things like vaccination or baby deliveries. And unfortunately, there's a lack of research and data and a lack of ability to be able to, give the support needed when it comes to vision. However, and that's where it's a sad story, I would say, when you're looking at vision care and how, disabilities in the vision space is impacting population, refugees are particularly vulnerable. First, as you know, they have to flee their home. They are in context where usually there's violence or conflict or climate catastrophes, and then the health system are not fully in place. They have to leave everything behind. They are highly distressed. When they move to new location, they are very often in rural areas or in camps, which are far from the health facilities. And so the access is particularly difficult. But also, if you had the extra burden of already they are in a very, distressed mental space, but you add the extra burden of, the vision disability, it's adding a lot of stress and also is impacting heavily the capacity to adapt, to communicate, to be able to embed themselves in a new culture and environments. Nearly half of the refugees, of the number I mentioned, are children and women, as you said. So, they go through education, for example. This is a bit of the lifeline for them, in those contexts. If you have issues with the vision, the impact is really, really big. And when I'm talking about women or men who have to look for a job, who have to, care and provide for their family, having vision disability is impacting them as well. So the really it's driving them even more into poverty and mental distress. So that's why, we cannot fix on our own, I would say, these issues, and we're really calling for a collective action. And that's why partnership, and I know we talked about partnership also in the session before, is absolutely essential if we want to fix the problem. The needs, just to say, are around research and data. It's around innovation, and I'm sure you will talk a bit about this. So looking at innovation, it's of course the funding, but it's also, helping us to raise awareness to the different local actors about the importance of this issue, and it's also about, training locally. And this, we can do it with the private sector.
Right, and you're talking about around 3/4 of refugees are in low and middle income countries where those who are finding themselves in host countries may not have access to healthcare, issues related to rural access, et cetera. And so I'm wondering very concretely, how are, to your point, partnerships, how are the one between UNHCR and OneSight really addressing those issues in concrete ways in those kinds of complex environments to deliver the access that those may not be able to gain otherwise? Go to you first, Anurag. Sandrine.
So there are two layers of impact that we are talking about when we are looking at a partnership like the one that we have with UNHCR. The first one is straight up a health issue which needs to be solved, which unlocks productivity, or the ability for these refugees to seamlessly integrate into the new context that they find themselves in. So on that one, obviously, working with UNHCR makes it easier for us to access these communities, and then we make it a point to make sure that these don't come across as one-off interventions. So we make sure that permanent capacity is built to take care of these communities even after the teams have left the location. The second order of impact is the fact that most of these refugees are hosted in low and middle income countries is also the biggest opportunities for us to create economic opportunities for them in the field of vision care, because that is the same geography where these 2-odd billion people who are looking for eye care are present. So the second order of action and impact is going to be us training these refugees to become vision care providers to those people in those communities. So we really think that this can have sustained impact, and we can turn this crisis into an opportunity, both for the communities that are hosting them and for the refugees who will reap the benefits.
Thank you for that. And Sandrine, can you give us some examples of some projects that you've been working on together on the ground? I know you've been in Moldova and elsewhere. How are you seeing this manifest and the kind of impacts that Anurag is talking about?
Just an intro line to say first that the partnership indeed with the One Sign Foundation is a good practice. And I will say just why very quickly. Very often we have a lot of companies coming our way who wants to give us a large number of glasses. This is a one-time intervention. And this is all well intended, but what we're looking at is really a partnership where, we have a partner like you that really want to be an actor of change, engage on the long term and at scale. So when we had a Global Refugee Forum in December, the One Sign Foundation made a pledge. And it means that there is a commitment over 4 years to support more than 100K refugees. And this is what we're looking at, this full service, so we work on this together. And we act through our projects on two key things. There is first, making sure that we bring the vision care service, equipments and so on to the people we want to serve. But there is also the second part that is, I would say, even more the most interesting one, which is to make sure that we build a local capacity so that the interventions and the projects are sustainable. So if we leave tomorrow, which is the hope, I would say, then the system is built. And indeed, we've been working in Italy, in Greece, in Moldova. If I just focus for 1 second on Moldova, the One Sign Foundation, we are establishing mobile clinics that are supposed to be temporary, but in those clinics, there is, the equipment that is given by the foundation, but you also have the training of local volunteers or staff who can actually, learn and then give the vision support. You have the equipment. You have also the ability to bring around the table the different local stakeholders. So I'm talking university, volunteers, the local authorities, and that's the strength of the partnership. So we raise awareness, we educate key stakeholders, and then of course, ultimately, we give the service and we support, refugees and the host communities, which is the strength. So it's not just the refugee, but it's also the communities in which they are embedded.
You raised so many important points about those kinds of interventions, not only the financing for them and the resources, often in places that are incredibly fiscally constrained, and needing to ensure that those investments of time, resources, training are sustainable. And how to do that so, as you said, so you can leave, and so the community can continue on in your absence. And so when you think about that, and the example in Moldova, Greece, Italy, elsewhere, how are you then replicating that? And how are you able to take those lessons learned and apply them to very specific contexts? Understanding you need scale, right? But they need to be context specific and relevant to the population that you're working with. And so, Anurag, how do you think about that? And then Sandrine as well.
So it's exactly what you said. It's context specific. So even though we have a very successful partnership with UNHCR in Moldova, primarily for the Ukrainian refugees, in Greece, in Italy, but it's context specific. We'll take our learnings from these locations, but let's say if we do a similar program in another community where the refugee population is probably a bit more entrenched. And it all depends on what is the time horizon for which we are trying to build an intervention. And which brings me back to the point that I was trying to make, that if there is a need to create new livelihood opportunities for the refugees, to become a part of those communities that are hosting them, by becoming primary vision care providers and earning a livelihood by providing vision care services to those communities, those are the steps that we will take. And that's like the second order of how this partnership becomes sustainable, becomes more permanent. And we don't need to, after 2 years, go back to the same community to do an intervention because we've solved that problem for good in the first go.
Mm-hmm. And how are you designing and crafting these programs also, again, so they're context-specific, locally relevant, but enable you to leave?
So I think without playing with the words, but I think it's first having the same vision. So having the same vision for the partnership and knowing that we have several years ahead, we can actually really co-create together. So it's not just a one-time thing. So we have system in place, with regular meetings, regular learning, bringing in, some champion within UNHCR, and it's the same within your organization, so they can exchange, learn, and every time readapt based on the good practice. I think there is also some more work that we will be doing coming up on this research, data, and measurement piece, because I think this is really something that we need to track, and that will be very useful to also share about the partnership and the success internally within our organization, and then ultimately bring new partner on board, because that's also the one of the objectives, to make sure that we inspire others to join and support.
Sure. And not only the research, but then being able to utilize that data for the direct and indirect and cascading impacts throughout the economy, as you were describing earlier. So we have just a few moments left, and as you were noting, these are complex issues, but one of the things I've appreciated in our conversations thus far and in the days prior has been both of your optimism and constructive approach to these issues. And in thinking about the opportunity here and thinking constructively, positively, what can be done, and your calls to action here in this space, and to those who are tuning in who may not be as familiar of the issue, or even thinking about some of the innovative partnerships that could be forged, what would be your call to action and your takeaway that you'd want this audience to hear? Sandrine, to you, and then Anurag, to you.
So maybe I will use one of the sentences you say at the beginning when you say, it might not even be a health issue, meaning that we know how it can be fixed. So I would say, what's important for me is it's the modalities of the partnership that we have. And I will be calling, if there's anybody in the room, I would say, who wants to be an actor of change and engage over a number of years to have a really sustainable impact, well, to come forward and talk to us.
And from my side, again, as I said, this is, for us, the One Sight EssilorLuxottica Foundation is the largest foundation in vision care. But that doesn't mean that we look at vision care as the end goal. We truly look at this as an enabler, a cross-cutting enabler. So our partnerships with UNHCR to improve the lives of refugees through the medium of vision care, or our partnership with the UN Road Safety Fund to improve road safety through the medium of vision care. Or, we worked with some foundations who focused on financial inclusion through the medium of vision care, creating livelihoods that provide vision care to their communities. So the only takeaway to people in this room and beyond is, if you're focused on education, if you're focused on gender, if you're focused on livelihoods, think about vision as probably an easy medium through which you can make sustained impact. Because if you think that there is no correlation between the impact area that you're interested in and vision, maybe think again.
Very well put. Thank you for bringing it to our attention and sharing your experience and your projects with us, which are replicable, scalable, and also inviting everyone in this room and those who are tuning in to connect with you, to think through how can we all be bolder, and really collaborate more effectively to have the impact that we're all seeking to achieve. So thank you. Appreciate it.
Thank you.
Thank you so much.